would just like to introduce the theme for our panel discussion this afternoon, and that is that mental health is everyone's business, is it? So earlier we heard a combination of great speakers about how they understand mental health to be everyone's business. And now we are really privileged to welcome all our panelists who work within research, education, and the care of children and young people and their families across the campus as people with lived experience, researchers, educators, and clinicians. And so, as I mentioned, Ken Knight is our esteemed MC, and Ken will introduce our panelists as he takes us through an incredibly rich panel discussion. The bios of all our panelists will be in the chat, so make sure you have a good look at who our wonderful panelists are. And I would also like to say that we have lived experience panelists among us, so if there's anything that you hear that is you feel the need for additional support, please reach out to your networks or to supports. So my last job is to introduce Ken. Ken Knight is a leader, practice specialist, and educator in the fields of research impact, engagement, and knowledge translation. He is Research Impact Manager at the Murdoch Children's Research Institute, where he leads an award-winning program to build capacity, capability, and an enabling culture for research impact and engagement. What a great intro, Ken. Over to you, and thank you to our panelists. Enjoy the session.
Thank you so much, Belinda, for that warm welcome, and welcome everyone. I can't tell you how much of a pleasure it is to be facilitating this panel discussion for Mental Health Week on the topic mental health, everyone's business, and that is a question today. To get into this, we've assembled, as Belinda said, a richly diverse panel of various perspectives, and today we'll be hearing from lived experience representatives and a range of clinical and research staff. Our panelists today are Jeanette Chan, Deanna de Cicco, Ralph Hampson, Elise DeBarco, and Elliot, and they will each introduce themselves in due course. But before we get to that, we have some brief housekeeping that I'm obliged to cover. So we invite you to submit any questions you have for our panelists via the Q&A function at the bottom of the screen, and we will endeavour to get to as many of these as possible at the end of the session. We also invite you to share any reflections that you have throughout the panel conversation via the chat function. So just a quick distinction there: questions via Q&A, reflections via the chat, and please be aware that if you do use the chat, then the entire audience will likely see what you say. And all reflections, as we said, will be available and open to scrutiny. So before we turn to our panel and their rich perspectives, I would like to put a warm-up activity to you in the form of a poll. We are very curious about your perspective as the audience on this question about mental health being everyone's business in general, and particularly at the Melbourne Children's Campus. So, to what extent do you agree with the statement that mental health is everyone's business? Please take a moment to indicate your responses. Do you strongly agree? Are you unsure? Do you disagree? Or do you even strongly disagree? And I'll just give you a few seconds to respond. A couple more seconds. Last chance to respond. All right, I'm ending the poll with 75% response rate. And maybe unsurprisingly, we see that the majority of you either agree or strongly agree, with a small number, one person, being unsure. I don't think that that is surprising, but hopefully we will get into some of the specificity of what that means for all of us in the ensuing conversation. The detail is always where we need to go with important questions like this. So, to the first question for our panel, what comes to mind when you consider the statement, mental health is everyone's business? Now, I'm going to pass to all of our panel members for this question, and I ask that you briefly introduce yourself before you provide your response. And the first person that I'm going to throw to is Caitlin.
Lucky first. Thank you very much. So hi everyone, thank you for joining. My name is Elliot and I'm a heart failure nurse practitioner at the Royal Children's Hospital, as well as the nursing manager of the cardiology department. First and foremost, I want to say I am not a mental health expert, and because of this, I actually initially thought maybe I'm not the right person to be on this panel. I'm sure that my limited formal mental health training is probably very similar to a lot of staff here at RCH. And through my over 15 years of experience, I have gained a lot of insight into trauma-informed care and some other aspects. So, you know, to answer that question, I think I'll separate it into the two hats that I wear. And in my clinical role as a nurse practitioner, I really see the importance about thinking of my patients as well as the family's mental health on a daily basis, whether that's through a head assessment, whether that's through referring to the experts and getting the care that they need, or whether that's just trying to provide the best positive experience for these patients and family while they're in hospital. There's amazing research, and we know that there are traumatic experiences that can lead to psychological issues or anxiety for these children going forward. And I think we all play a role on that day-to-day basis to try and ensure that they have the best experiences possible and try and minimise that trauma that they may face at the hospital, whether that's through a procedure, pain, or a severe illness. So I think from a clinical perspective, anyone who's involved in these children or families, anyone who meets with them, has discussions with them, have a responsibility to try and reduce that trauma that we can inflict from a hospital. My manager hat, I do, obviously I've got a large team and I manage people, and I think there's a different way of looking at it for mental health being everyone's business from a manager. And I think we all have a responsibility to look after each other in our workplace and to consider people's mental health. And as an organisation, I think we have a responsibility in a manager role to ensure a supportive and a mentally health safe environment for our staff. We all need to be well and physically well to come to work to provide best quality care, but we also need to be mentally well to do that too. So I think it's everyone's responsibility to look after their mental health themselves, but also to look after the mental health of their colleagues. So that's my two different hats and my perspective.
Fantastic. Thank you, Caitlin. Jeanette, I'm now going to throw to you.
Sure. Hi, everyone. My name's Jeanette. I use she, they pronouns, coming to you on Wurundjeri country. I also like to acknowledge the traditional custodians of the lands on which we're all coming from today, and pay respects to the elders past, present, and emerging, and acknowledge that this land was stolen. Land always was and always will be Aboriginal land. I'm a lived experience advisor here on campus, so I work across a number of key areas of the mental health strategy, family-centered care, trauma-informed preventative care, and research. And by trade, I'm an economist and a public policy professional. And when I think about the statement, I think absolutely yes, mental health is everyone's business. Duh, you asked a lived experience advisor. Especially after the last few years, mental health is not this thing that's like off to the side and separate. It's very much, when we think about health in its broader sense, mental health and physical health very much sit next to each other. And for me, what's really important is that in the way that we have basic physical health literacy, I think it's really important to build a basic mental health literacy. You know, it helps us understand where people are coming from, but it also helps us deliver more compassionate and empathetic care. As someone with lived and living experience of complex mental health issues, I experience a lot of stigma and discrimination in some of the spaces that I go into. A lot of times I think unintentional because people are uneducated. So I think having a basic mental health literacy helps us cultivate safer, more inclusive spaces because people have a teeny bit of understanding as to why I am the way I am. But I also think the value add for all of us here is that we get to deliver more patient-centered care. Thank you.
Thank you so much, Jeanette. And I'm now going to throw to Elise for your perspective.
Hi, everyone. Thank you so much for having me on the panel today. I'm Elise. I'm a paediatric advanced trainee working at the Centre for Community Child Health this year. I work in a variety of outpatient settings, including in some specialist clinics at the Royal Children's Hospital, but I also do 2 days a week in my community health centre, which is where I'm joining you from now, actually in North Richmond. And I have to say, in my first year of community paediatrics, mental health has really been a core part of business, particularly for the patients that I've been seeing. And as everyone, oh, sorry. And as I've said, in the wake of, that was my watch listening to me, sorry. In the wake of the COVID pandemic, we have definitely had an increasing number of children and adolescents presenting to paediatricians needing extra support and assessment for mental illness. And so I think when I hear this statement that, you know, thinking about mental health is everyone's business, it just brings me a real sense of excitement for the future, that there is change on the horizon about how we are going to conceptualize mental health and better respond as professionals. And I think from a personal perspective, I think the statement just brings a sense of hope, because I think experiencing mental illness can be a really lonely experience, and particularly for some of the adolescent patients that I see, it's just being able to bring this sense of mental health into the collective consciousness, so that it's something that we are thinking and talking about all of the time. I think is going to go a long way to reducing the stigma. So yeah, I'm so glad to be part of the discussion today.
Thank you, Elise. It's brilliant to have you part of the discussion today. Dee, I'd like to ask for your perspective now.
Thank you so much. My name is Dee. My pronouns are she, her, and I would also like to acknowledge the traditional owners of the land which we are meeting on today, and I'm broadcasting from the land of the Wurundjeri people of the Kulin Nation. I'd like to pay my respect to Aboriginal elders past, present and emerging, and extend that respect to anyone joining us today, and would like to acknowledge anyone with a lived experience who is joining us today, especially people from our First Nations people. So I'm a young person with a lived experience of chronic illness, mental ill health and disability, and work as a lived experience advisor and youth advocate here at RCH, and also at Origin Youth Health and Headspace. And when I hear the comment, mental health is everyone's business, I have a lot of mixed feelings about that, because I don't think not only is it everyone's business, but I think it's everybody's responsibility and everyone's duty. And I don't think we have a choice anymore in whether or not it's someone's business, because it's here and you can't ignore it. And the more we ignore it, the more damage we do. So I think that, it's everyone's responsibility and everyone's duty to become informed, knowledgeable and aware of mental health and mental illness within our own life, within our society, within a hospital setting, everywhere.
Thank you, Dee. And now, last but by no means least, I'm going to ask Ralph for your perspective on this question.
Thank you, everyone. My perspective on this question is really, I think no one will disagree with the statement. So I think that if you said to anybody, mental health is everyone's business, most people would say, well, that's a good idea. For me, I think, and I'm an associate professor in the School of Social Work and used to work at the Children's a long time ago. And I think the question is, well, how do you implement it when it's everyone's business? And I think it's a bit like teachers are told you have to understand child development, but what does that mean in practice? So maybe it's just I'm a practical person, but I think most people will agree with you. The tricky part becomes, how do you actually make this work in practice? And if I think of myself back to being a young clinician, the first thing I'd be asking myself is, well, what does this mean for my everyday work?
Thank you, Ralph, and everybody. I think we've already kind of touched upon such an interesting and exciting array of perspectives and necessary secondary questions. I'm now going to launch into some of those, and we can get into the real meat of this conversation. So the next question is really around the distinction between mental and physical health. Usually when an individual is physically ill, it is well understood and accepted that they're not well. When it comes to mental health, however, this can be viewed quite differently. Why do you think that is, and how can that dichotomy be overcome? And Elise, I'd like to ask you to respond to that first.
It's a big question, and it's one I've been thinking about a lot since we've decided to come together for the panel discussion. And I guess my perspectives and answers to this question are going to be very much shaped by the clinical context that I work in with young children and adolescents. But I think about it as being viewed differently for sort of three reasons. There'll be more, but I think firstly, there are gaps in our knowledge when it comes to our fundamental understanding of the neurobiology that's underpinning the symptoms and signs of mental health conditions. I think the second thing is that there is a complexity of the clinical presentations that we see across the ages and the developmental span of children and adolescents. And then the third thing that I think about are the societal and cultural factors that are shaping our understanding of mental health in children as well. So I guess in terms of that knowledge gap, when it comes to the science, whilst I acknowledge that we're definitely making advances when it comes to our understanding of how mental illness is manifesting in the brain from that sort of molecular level changes, the thinking about the signaling pathways through the brain, the different chemicals that are involved, where we're slowly making gains. But I think we've still got a long way to go, particularly when you compare something like anxiety or depression to a urinary tract infection, where we know what bugs are involved, we know how they get into the bladder, we know what antibiotics we need to treat them with. We're operating, I guess, in two very different spheres of knowledge. And then in addition to that, we have this complexity of clinical presentation. So when I think about my own patients, it can be very difficult to tease out what symptoms and signs are part of a mental health presentation versus a physical presentation, particularly when there's a significant overlap. So a child, for example, who is having difficulty sleeping could have a primary organic cause like obstructive sleep apnea, or they could be anxious. And so you've got the same fundamental symptom, but two very different causes. And so teasing that out can be tricky. And then I think for me, the thing that has been most significant in my work this year is understanding how powerful behaviour is as a presenting feature of mental health difficulties in children. And these behaviours can then be modified by a number of external factors like your parenting style or your temperament or the environment or trauma or a pandemic. And so you could have two children who both have anxiety but who are presenting with very different behaviours. And I think it can make it really challenging for clinicians to really identify, assess, diagnose and treat in a really consistent and effective way. And then, of course, there are societal and cultural factors that play into it. And I wonder, Jeanette, if you wanted to speak to that, because I think that will be something with your lived experience that you would be able to expand on much better than I can, I'm sure.
Thank you, Jeanette, please.
Yeah, absolutely. I mean, yeah, to Lisa's point, very much the things that you're saying really resonate with me. I think for me, two things really come to mind. The first is the term health has traditionally been synonymous with physical health. So it's not surprising, but it's obviously undesirable that mental health continues to be treated as separate or different. And the second, I think that this question really gets to is that our mental health or mental ill health is often invisible and incredibly messy. It's not something that we can explain in two short sentences, and it's relatively hard to stuff into these neat boxes in a clinical or a research setting like Elise was alluding to. And because it's so messy and unpredictable and our workplaces value efficiency, it's often not a priority. You hear the thing, we don't have enough time, we don't have enough resources. There just isn't an incentive to try something different a lot of the time. And sometimes you might hear a story, or you yourself might have been caught in a conversation with a patient for an extended period of time that in the moment you felt like I've got something more important to do, and you couldn't get out of it. I think it's really important, as Elise was saying, to remember that conversations around mental ill health often reflect underlying structural social issues that we can't easily resolve in a healthcare setting. And I think that's what makes it, we have this resistance to try to explore mental health or have conversations around it, because it is challenging and it's an unknown. I would say in response to all those sort of concerns, and in addition to improving our mental health literacy that a lot of us have alluded to already, I'd encourage people to be really open and curious to having conversations about mental health and well-being with your colleagues or with patients. because for someone with a lived experience, when someone takes the time out of their day to have a really small conversation with you, literally like 2 minutes, or just ask me a question, it makes a world of a difference. Because even though I'm going through this really tough thing, oh my God, that person like actually cares about me. Wow, okay, maybe I can get through this. Maybe it's not as bad as I think it can be. So I think while mental health has been treated really differently, there's absolutely many things that we can do to overcome that. And hopefully that's not the status quo in like 20 years from now.
Thank you, Jeanette. So I think already in the conversation today, we've heard a lot about stigma, and that's where I'm going to head next. So stigma and fear around mental illness can contribute to a belief that mental health isn't everyone's business. What do you think organizations and individuals can do to increase our understanding and reduce stigma around mental health? And Dee, I'd like to pass to you.
Thanks, Ken. So I think this is a really big question because there's a lot of different avenues that we can go down and look at of like how to address this. But one of the things that I think is really important, and I don't think it's spoken about as much, is are we supporting clinicians and staff to talk about their mental health? Are we supporting them and their mental health in their places of work? Because if not, how can we expect them to have the capacity to carry other people's mental health? If you're not giving people a safe space in their workplace to talk about their mental health and give them time and space for their mental health, then how can those people how are they able to understand and deal with like these patients who are coming in that are really struggling with their mental health? I think it's kind of we've got to practice what we preach kind of situation. I think it's really important, something that isn't taken into account as much. It's really easy to say, oh, we need to be like asking questions, we need to just be confident enough. But if staff aren't feeling safe and confident enough to talk about their mental health and have their mental health supported, then I'm not too sure we can address one without addressing the other. I hope that made sense.
Perfectly, thank you, Dee. And Rolf, I'll now ask you to respond from your perspective.
Just remember to unmute. The thing I'd say is I think this is really complex, because I think there'll be staff members who want to share their lived experience, and everyone in the hospital will know someone who's had a mental illness. So we're all touched by mental illness. And until, when I went to university a long time ago, no one would have talked about their mental illness. So we've come a long way. But I don't think we can be prescriptive about people having to share their experience or not share their experience. So I see that in students I teach at the university. Some people are very happy. Others I know privately have a lived experience, but they don't want to share it with other people. So my thoughts about this is, how do we encourage conversations at a campus like the Children's, which have humility, kindness, and a curiosity, as Jeanette said, to the conversations, because mental health still remains a quite contested space in many ways. And even the guidelines that came out yesterday on working with transgender people and mental health have caused massive controversy. So I think there also has to be a level of, I really like Jeanette's word about curiosity about what others think, but I don't think we can prescribe what people have to do with their own experiences. But we all have to have humility and kindness when we're hearing about mental health. And the one that always stands out for me, having worked at the Children's, parents may not agree on what the team are suggesting for the kid. So that we're also dealing with family histories, culture, that I've worked with people from different cultures where, mental health is a punishment from. So it's very complex, and it's that complexity we have to have some humility around, I think.
Thank you, Ralph. And Elise, I'm now going to ask you what your response to that question around addressing stigma might look like.
I think that I think from an organisational point of view, I think part of reducing the stigma around mental health is by valuing the ways of working that support employees to achieve mental health, if that makes sense. So creating a culture that allows people to work in sustainable ways, that promotes a sense of control over their work, that allows them, working conditions where you can be accommodated if things happen unexpectedly, and I guess having pathways for support that allow a conversation to occur without risk of discrimination or reprimand. I think it's about creating an environment where people are able to do their work, but also be able to do it in a way that is actually sustainable for them. And I guess everyone's going to be different in terms of what they need in order to achieve their own mental health. But having that flexibility inbuilt into the system, I think, is really important, and having that flexibility there in a genuine way that can be used for people when they need it. And then I guess from an individual point of view, I think you're right, Ralph. You're completely right, Ralph. Not everyone's going to be comfortable talking about their mental health, but I think I've found I'm embracing Brene Brown at the moment, and I know she's big on vulnerability for those of you who are familiar with her work. And I don't know whether Ralph's sitting there shaking his head in silent judgment, or whether that's how I like Brene Brown. But I think that embracing vulnerability is really important, and it's something that I try to do every day with my families. And I'm very honest with families about the things that I've experienced in my life, the other patients that I've seen, their journeys, my journey, what worked, what didn't work. And I think just being open to being a little bit vulnerable can actually be a really lovely way to make people feel comfortable to open up back to you. And I think that that's something that can be tricky to do, but something that I definitely try to do in my day-to-day work. Yeah.
Thank you, Elise. Now, we've touched on this as well a couple of times in the conversation, but I think we can all agree that a key strength of the Melbourne Children's Campus is the access that we all have to great minds and great leaders across the Royal Children's Hospital clinical teams, the Murdoch Children's Research Institute's research teams, and the University of Melbourne's focus on high quality, excellent education. How can we better integrate everyone's work in kind of, bringing this ethos of mental health as everyone's business? How do we unite clinical research and education initiatives? And Ralph, I'm going to ask you for your perspective on this first.
Yeah, look, I think what's really important, and I think we already do this, so I'm not a pessimist about this area. I think there's a lot of work going on between people in the university and practitioners. I think the more we can involve practitioners in research, so it's not done in the ivory tower, but is actually done about real problems in the real institution. And then I think there is a real push now to involve people with lived experience. And I actually in principle agree with that, but I don't want to a moment suggest that it's easy. That in fact, you have to put a lot of thought into how you're going to include consumers or people with lived experience, and our responsibility to them to what do we do with the information that comes out of any research project. So, people, and not setting people up for disappointment. So I think it's having really strong structures and formations around the research that we do that include people, and also being honest with the whole team that in the end, we're probably going to come to we won't all be able to agree on everything. And that's an important thing that a research team has to then grapple with at the end. But I think the Children's, from my point of view, is a very good place for, and always has been from when I was there 30 years ago, has always been a place that's been interested in research. And I've certainly been in projects that have involved young people with mental health issues. So I think we're on that track. We just have to get stronger at it. And I guess the plug would be perhaps more research positions that are between practitioners and researchers, joint appointments between the two institutions. But I think I would say I'm optimistic about the future.
Thank you, Ralph. I'm now going to ask Jeanette, what's your reflection on this? How do we bring clinical research and education together to address mental health?
Sure, Ken. Yeah, massive question, really. And thanks, Ralph. Really agree with everything that you said. I think just to start off, events like this are really great, just forums and spaces for bringing people together that we, to break down the silos that we can sometimes find ourselves in when we're caught up in our day-to-day work. It's really important to make it a priority to have these types of conversations and to seek out collaborations, because I think that's really important. And to Ralph's point, I think there's a really great work that's already going on. And I've seen firsthand in the sort of like few months that I've been with the campus, how vertically integrated some of the work that we do. As you can tell, I'm an economist. I use the term vertically integrated. But I think there's a real opportunity there, because we've got such smart, intelligent, thoughtful people doing all these different things. And to Ralph's point, I really want the ask is to consider embedding lived experience perspectives across everything that you do, because ultimately we're all here because we want to deliver consistent, high quality, compassionate, empathetic care, and lived experience perspectives, or consumer perspectives, if you will, help make sure that our work is as fit for purpose and as possible. And yes, it can be challenging because we're charting this new journey and trying to figure out how we work together. But I think there's a huge opportunity there. One of the things I'm particularly excited about is more lived experience researchers. I know we do, in my experience, we really do a really good job of having both clinicians and researchers, but I think peer researchers, lived experience researchers, and articulating what that looks like moving forward would be really exciting.
Thank you, Jeanette. And I just a quick and somewhat shameless plug, but for those of you who don't know, both the hospital and the Murdoch Children's Research Institute are in the process of formalizing and strengthening consumer engagement in clinical work and research work infrastructure currently. So hopefully we will see all sorts of really exciting work in this space moving forward. Now, I think we also all know that coming to hospital can be a scary or even traumatic experience for kids, for young people and their families. How do you think we can prevent unnecessary trauma and support the mental health of kids, young people and families? And what are strategies do you think that we can implement to build positive experiences? And Caitlin, I'd like to ask you to respond to this question first.
Yeah, thanks, Ken. For me, this question really highlights the need for trauma-informed care. And I know for our mental health strategy, this is a focus point for that. So it'll be really interesting to see what comes out of that in the coming years. But really, trauma-informed preventative care, it recognises that pain, serious illness and medical procedures can lead to psychological and physiological symptoms of traumatic stress for our children and their families. So first, I think we need to acknowledge that. Yes, they might be here for a physical illness. Yes, it's extremely important that we get this blood test done or we do this casting, but I think we need to acknowledge and consciously think each time, what am I exposing this child and this family to? What trauma am I exposing them to? And is there a way that I can mitigate that? And in most cases, there are ways we can reduce that. So I think procedural trauma is something I'm most comfortable with. The patient cohort I look after usually have lifelong care needs and very frequent procedures, everywhere from a neonate all the way to 18 years. So I have a very long life care with these patients, and I'm very fortunate to be able to see them grow up. And I've seen it go very well, where these children can come in and 3 monthly have multiple tests, painful tests, and do it with a smile on their face. And I've seen it go really bad. And I've seen such stressful experiences for these patients with the same procedures that it's caused such severe anxiety that we need to give pre-meds for them just to get into the hospital, let alone to do that procedure, or the need for quite significant sedations for, a non-painful procedure. So I think the effects are quite extreme. I think we have to know and be aware of those effects, acknowledge that, and take responsibility that I might be having an impact on that longer term psychological health of that child. And then it's tapping into resources. We're so fortunate at this hospital that we have fantastic resources to support procedural care. The child life therapy are fundamental and really good at integrating play and distraction and strategies to improve the experience and make that a positive experience. nurses might not like this because, you know, we're busy, but time is really important. When you have a really busy patient load and you have a task list that you need to get done, it's sometimes hard to stop and pre-plan and take that time to actually think, what can I bring into this procedure that will reduce trauma for this child? And I think it's such a fundamental thing that at times I do see it get skipped over because of their busy workload. But if you can just take that time to pre-plan that procedure with the family. So I think this is another really important thing, that there's not one recipe that works for every single person. In fact, every child is different, every young person is different, and working with that young child or person and their family to work out what strategies will work best for them, I think has a big impact on the trauma that they may face. And then lastly, communication is just such an important strategy that I think we can utilize to reduce that trauma. And I think that's communication prior, planning, explaining what they're going to be exposed to, but also communication afterwards and providing a chance for that debrief to happen, to talk about what may not have worked well, what we could do in the future to try and reduce that stress, or what worked really well. And then how are we going to communicate that to the wider team so they know moving forward what's a good strategy for that patient. So I think there's a lot of things to do. I think acknowledgement, accountability and taking responsibility is a big part of it. And then just utilising your resources, dedicating some time to actually plan out procedures. And I know everyone tries their best, but we can all do a little bit more, me included.
Thank you, Caitlin. And Dee, I'd like to ask your perspective on this as well.
So I guess from a lived experience perspective, as someone who has both lived experience of chronic illness and disability and mental health, this is something that is very, very important to me and very close to my heart. And as a child or adolescent, I also received a lot of my care at RCH. So there's a lot of lived experience going on there. But I think this actually really goes along with that question of like stigma. And I think part of us being able to provide I guess like more trauma-informed care and being able to make hospital a less traumatic like experience for people and all altogether goes along with everyone being more educated on mental health in the first place. The same way that we have this expectation that every single person working in the hospital knows first aid, right? And every single person in the hospital would probably know how to take a blood pressure and check someone's heart rate because you were in a hospital, and like it's really important that we know how to manage those things. And mental health shouldn't be any different. Everyone should know the basics. I'm not saying that everyone should, be, working in a NICU ward and then also be like, a qualified like clinical psychologist, like all at once. But I think it's our like duty and responsibility that we all know the basics about mental health. And I think when we know those things, they will automatically become part of the care we provide to people. And that would inherently prevent a lot of trauma. I also think that we often silo mental health and physical health. And the reality is that receiving any form of care, whether it's for your mental health or physical health care, is traumatic. Coming into hospital is traumatic. Going into ED is traumatic. Going into an ambulance is traumatic. And so once we acknowledge that all of these experiences are traumatic for people in different ways, we look at how can we make them safer? How can we make that space better? Because we can't change the fact that hospitals are really scary. They will always probably be scary for a lot of people, even the people who spend most of their life in them. But I think when people are happy to talk about it and people can understand that, yes, you might be here because you are having an admission for your physical health, but let's check in about your mental health. Let's make sure that we have spaces for people to talk about their mental health. Let's make sure that when people aren't feeling safe with a nurse or doctor or allied health professional, that they have the space to say, I don't want to see this person, or I don't want to talk to this person. I think all of these things are really important. I know they're like big things, but I also think they're quite simple things. And it's like people's right to come into these settings and to feel safe and to feel heard and to be able to receive like safe and informed care. And I think sometimes, especially with children, there's a bit of this unspoken thing that goes around that like we don't have to know as much, or that they don't need things explained to them as much because they're children and they don't understand, which like, yeah, children don't need like, you know, big words explained to them, but they still deserve to be told what's happening to them and talking, you know, about them when their parents are right there and they're also in the room. That's trauma, like that's traumatic for young people and children. So I think being aware of the things that we're doing wrong helps us to be able to change those things and make them right. And I think that's really important in the way going forward.
Thank you very much, Dee. Now, we are rapidly running out of time. I wish we had so much more time to kind of do justice to all of these really fascinating and important issues, but we're moving into our final official question for the panel before we get into some audience Q&A. But my final question, and I'll put this to each of the panelists, is what is one key message you would like people to take away from today's conversation? And Jeanette, I'm going to ask you to begin.
Sure. I think for me, it's to be open and curious and patient, actually, because changing the way things have always been done doesn't happen rapidly overnight. The journey of building our mental health literacy and of change takes time, and it also takes time to see and to realize its benefits. But it's absolutely worth it, 110% worth it, because what you do matters. And sometimes it might feel like it's too messy or too hard or doesn't make a difference. But, you know, as, you know, Dee was saying, like, it absolutely makes a difference. You know, even if you don't see it, your intent and desire to change is what matters and what counts.
Thank you, Jeanette. Elise, what would you like the audience to leave with?
I think I have to go with the clinical message. Behaviour in children is a way of communicating emotions. So be curious, keep an open mind, notice them, and start a conversation with your kids about how they might be feeling.
Thank you. Dee, what would you like the audience to leave with?
I guess maybe I'm going to go back to what I kind of said at the start, that mental health is not only everyone's business, but it's everybody's responsibility and everyone's duty. It's not a choice of whether you're interested in it or not. It's not a choice of whether you want to learn about it or not. And it's not a choice of whether or not you're going to bring that mental health knowledge to the space that you work in. It has to happen. The time is now. I know it's scary, but even the smallest changes that you're making every day will make a big impact to our system overall.
Ralph, what do you think?
My unmute button. I've been thinking about this a lot since we met earlier this week. I think one of the things I'm curious about is how fathers are included in this work. Is that most of the work goes on often with mothers and children and young people, and fathers are often excluded. So I think there are some gender differences about how men maybe experience mental health. And even in our workforce, I'd suggest there may be some differences between how different genders deal with these issues. So I think that's important. And the other thing is to create a message of, whilst we have, you know, a lot of challenges to health professionals, they also need support to make change, and they often need resources to do that, or education, and just telling them that they have to change without all of that around it is a bit like doing the same thing to people with lived experience as well. So how do we scaffold this plan so that, and also how we know this plan has been successful?
Thank you, Rolf. And last but certainly not least, Caitlin, what would you like the audience to leave with today?
Thanks, Ken. I'm a true optimist at heart, so I'm going to leave on an optimistic note. But I think, yes, there's a long way to go, but we have made a lot of progress, and I think it's exciting to see what's to come in the future. I think there's going to be amazing emphasis and extra resources to support everyone in enhancing their mental health knowledge. But I think now that most people do have the skills, if they have are conscious and can think about, especially from a traumatic experience, what can I do to reduce this traumatic experience for our patient coming into a hospital? You have the capabilities to be kind, to be open, to be curious, and that will have a positive effect on someone's mental health. So do that and do it every day. Don't do it as a one-off thing. And it comes naturally after a while.
Thank you, Caitlin. Well, that concludes the very formal part of the question and answer, but now we're going to turn the discussion over to our audience members. So this is a reminder to please submit your questions via the Q&A box if you have them. We have one question, which is, what are some tips that you have that can help develop stronger self-advocacy from a consumer or lived experience perspective when it comes to mental health issues, especially in a medical setting? So for example, seeing a GP, and especially when you are part of a particularly vulnerable community, First Nations, queer, with an experience of disability. Jeanette, I'm going to throw to you first with this one.
Sure. I think for me, when I reflect on my own journey, a lot of it started with learning that self-advocacy was okay and encouraged, and actually made my experience and my life better. Because in the beginning, at least culturally, you're like, I don't want to burden someone else. Oh, am I allowed to say this? Am I not allowed to say this? And some of the things for me that helped me advocate more for myself was having my partner with me, or a loved one with me who encouraged me to do that, and not having an expectation on myself to figure it out right away, like to learn over time what it meant to advocate for myself and figure out as I went along what my needs were and how I wanted them to be met. Because I don't think when you ask someone to advocate for themselves that they quite know at the start what it is that they need, or they might know it, but they're not quite sure. And being open to the idea that that can change over time, and it's self-advocacy is a skill, I think is super important.
Thank you, Jeanette. And Dee, can I get your perspective as well on this? How can people self-advocate better?
I think, first of all, like being aware that like self-advocacy is something that you're like going to have to step into can be a really daunting and challenging thing to like kind of notice. So I guess like just sending a lot of love and care your way, because it's a really overwhelming thing when you realize that it's really difficult when you are the patient or you are the unwell person or the person who needs help, and then you also have to be your own advocate at the same time. So I would very much agree with Jeanette. Like if you have someone that you feel comfortable having in the room for extra support, if that makes you feel safer, if that makes you feel stronger, if that makes you feel more confident to use your voice, then absolutely go ahead, do that. Something that I've personally done is I used to take a notebook into some of my appointments that I felt particularly vulnerable in and felt particularly not heard in, and I wouldn't actually write down anything important. I would literally just be writing down random things, but they didn't know that, and like that made me feel a bit more empowered, because you know I felt important too. Like they're typing at their laptop, well look at me, I'm writing in my notebook. You know, you've got to match their energy, match their confidence. A lot of like doctors and GPs, and that when you kind of, I think sometimes they can almost feel a bit uncomfortable when you tell them what you need instead of it being the other way around. And you kind of have to try to match their energy, and know that it's your right to receive that healthcare. You're entitled to receive, like, you know, safe, accessible healthcare, and you deserve to be heard. So don't think that anything that you're doing is not allowed or is dangerous or risky. And I know it can be particularly difficult from like a disability perspective, because we're often kind of like infantilized and looked at as maybe not knowing what's best for ourselves. But trust in yourself that you do know what is best for you. You know your body best and you know your mind best, and you deserve to receive treatment and help, and make sure you go into all of your appointments knowing that you deserve quality care, not just, you know, meh care.
Thank you, Dee. It's a really rich and inspiring response. Rolf, you've got your hand up, but Caitlin, I just wanted to check. You had your hand up a minute ago. Did you purposefully take it down, or did it just go down?
Because Dee covered it.
Fantastic.
The notepad was my suggestion. And it's also some patients have given me the feedback of coming to the appointment with written questions, so they can actually go back to it. What did I want to talk about? And when they read it, they find it a little less intimidated because it's written there in clear language. So another little tip.
Thanks, Caitlin. Ralph.
I think it's how we use social media, particularly with young people. And I think, Dee, you're absolutely right. And certainly 30 years ago, I would tell people different strategies to get their health professionals to listen to them. But giving people tools, it is important to say it's people's right, but that isn't enough. Often people need tools about how do I open the conversation? What are the questions I should ask? How can I do that? And I think places like cancer have done really great work in that area about people have cancer and how they deal with health professionals. And I think mental health could benefit from a lot of that work, that there are tools that we can use. Whilst we're all unique, we also can find things that are commonly helpful to people. And I think that's the wonderful thing about lived experience. And that was about getting people to share what worked and what didn't work with one another. So I think that's important. And even simple messages around the hospital that kind of give out a message that we do care about mental health.
Thank you, Ralph. We've talked about the value of sharing lived experiences, and Dee, you really beautifully framed, the importance of allowing staff to acknowledge and share their lived experiences. We've had the question come in around how can we better support staff to share their experience, and Elise, I'm curious about your perspective on this.
I guess the strategy you might use will depend on, maybe where you work in the hospital and what the organisational structure is around your particular position, and whether you work in a team or whether you're a consultant. Are you sort of just starting out in your career, or are you at the end and working with an executive? So I guess I would just speak from my own experience. And I think the best support that I've ever had has really been the support that's been role modelled by my senior colleagues, really. So I think that particularly at the Centre for Community Child Health, with the work that we're doing as fellows, we're often working in quite vulnerable communities with families who are experiencing quite a significant degree of sort of social, financial hardship. The children that we're seeing are often really struggling, and so they're very mindful in the way that they've supported us. So for us, it's really just about having regular scheduled contact with our supervisors, where we can bring cases to talk about not only the case, but also our response to them. And actually something that's been fantastic this year that our current senior fellow has set up is actually some monthly supervision sessions with a psychotherapist to talk about cases. And I have to say that's just been really transformative, I have to say, in terms of my own practice, the way that I think about the experiences that I'm having with the families in the room. And these sessions are actually giving me clinical information. So reflecting on how the conversation that I'm having with a family and a child is actually impacting on me is giving me important information, but it's actually also helping me cope with my own emotional responses to those conversations. So that has been incredible, and I just think it would be absolutely fantastic if more doctors could access that. It's been such a privilege.
Ralph?
I just want to add to that. I think supervision is important, and I come from a profession that's always had clinical supervision. But I think the other thing is we always teach our students, you only disclose about yourself if you believe it will be helpful to the client or patient. And I think that's really important to keep in mind, is that when a health clinician, it isn't just about sharing their experience, they have to have intent and know why they're doing that. Otherwise, it can become a burden for the actual person you're working with. And I can't emphasize that enough. We're there in a professional relationship, but also how is sharing beneficial? And you could place yourself in an unsafe situation as a health professional in some settings.
Thank you, Ralph. Dee, do you have a quick response to this? I'm conscious that we're almost out of time.
Yes, very quickly. I just wanted to kind of add, when I did make that comment before, I was talking about lived experience, but also just generally clinicians, healthcare staff, having a space to feel comfortable to talk about their mental health in general is really important. I think we know that healthcare workers generally are probably the least supported in terms of their mental health and health in general. So I think I wanted to reiterate that, my comment before was about being able to share their lived experience, but also them having a space for their mental health in this current moment in time as well.
Thank you, Dee. Now, we are very much almost out of time, but I have one very interesting question. I feel like we are unanimous as a group from our poll and from this discussion that mental health is everyone's business. But what would you say to someone who strongly disagrees with that statement, that mental health is not everyone's business? Do we have one or two quick responses that you can share before we close?
Mine's super quick, so I'll go. I'll listen. I would be curious and listen to why. I think it's good to have people with different opinions. It enriches us. So sitting there, being actively listening, and then see what they say, and maybe challenge them, but just getting their perspective is important.
Thank you, Caitlin. Does anyone else want to have a quick and pithy response to that? No, all good, all good. Well, look, we are out of time, and I would like to, on a personal level, as the moderator of this chat, say a very sincere thank you to the generous and thoughtful and brave contributions of our panelists and to the excellent engagement from our audience. And I will now hand over to Belinda for some closing remarks. Thank you, Belinda.
Thank you, Ken. I don't think there's much more for me to say except thank you to Ken as our esteemed MC and to our panelists. And I'm sure everybody would join me in thanking you for sharing your thoughts, albeit under time pressure, and how do you elaborate on things that you've taken a lifetime to learn about. So we hopefully will take your comments and thoughts away for greater reflection. The ones that I really will stick with me is thinking about fathers and care, other partners is really, really important. Mental health is everyone's responsibility. Your intent and desire is what matters. And finally, simple questions create connections and give hope. The person cares and it's going to be okay. And finally, I'd love to thank the staff that work across the campus at the Royal Children's Hospital, MCRI and the Department of Paediatrics at the University of Melbourne and the Royal Children's Hospital Foundation. We hope that you take from the session today that we see you as our greatest asset, both in the strategy and in the excellent care of children and their families. And if there's one thing that you can take from the conversation today is greater reflection and openness to your own and others' mental health and well-being. Humility, kindness, and curiosity, I think, Ralph, are our three words. So if we can leave everybody with those words, thank you so much to our team and to Ken and to the speakers and panelists, and wish you a great day. Thank you so much.